Hello everyone, once again welcome to my IT channel. Today I came with the introspection of OET letter writing. Today's date is 24 February 2024. Okay, so today's exam was a little bit tough in case of listening and reading, but letter was okay because most of the students they got like non-case letter. In some area it was like unknown because we have two types of letter. If you are taking like Arab countries, we have only one, and in Ireland it was only one exam question paper, but in India almost you can expect two variety type of letters. Anyway, we will have a short description of the modules: writing, listening, reading, and speaking. And at the end of the video, don't skip the video to see a model answer letter. It's, I can tell you that it's not exact as exam because I got some information from my students. It's not clear at all. So just I summarized what are the important things and I made it okay. And those who wrote already the exam, and if you're watching, if there are the things, if it is missed, just comment in the box and please don't take it as like it is the exact answer. Okay, so we will move to the writing. Some of them they got letter to the family GP, and you are the school nurse, you are working in the school, and you have a patient named Ellie Wood, and she is 13 years old. She recently joined in your school. They have given the date like September 23 or 24, something like that. And since then, she has the problem to adjust with the new environment. Moreover, she has some issues with the acne. It started all over the face, and it started to spread through the neck and back side of the neck as well. And they tried some topical over the counter medications, but it was unresponsive. So you are worried and you are concerned about the spreading of acne. So that is a one reason. Moreover, you are observing that she has low mood due to the recent loss of her grandparent, one of the grandparents, as well as she is not at all interested to do the physical education, and she is somewhat socially withdrawn from the other friends and teachers, as well as her overall social activity is declining. So there is mood changes, so you are somewhat concerned about this problem as well. So you are as a URS and school nurse planning to write a referral letter to her family GP regarding her acne treatment or acne issues, as well as the mood changes. So the task is you are writing a letter to her general practitioner for the acne management as well as for the emotional support. So this is the overall idea about the writing task. So this is one writing task, and in India, some of my students they got a letter writing. You are supposed to write a letter to respiratory specialist, and this one also a baby, not baby, child, 13 years old, who has asthma, who has had asthma for the past 5 years. I hope this is exacerbation of asthma, and you are requesting to evaluate her condition and to do the medical review, as well as to provide some more like specialized treatment. So I didn't get many for points regarding this letter. If I get information, I will do it as separate, and I will try to write a model letter. Okay, so this is overall idea about the writing task. Regarding the speaking, so I got 6 topics from my students. One is you are the staff nurse working in a clinic, medical clinic, and you are talking to a patient who is getting discharged after the management of second degree burn in the arm, and it got happened 6 weeks ago. And you are explaining regarding the management after discharge, regarding the follow-up visit, everything. Second one, you are talking to a mother of 7 years old baby. She has undergone one surgery, but I'm not sure about the surgery name. And you are talking post-operative management. And we have another one, role play card. You are talking to the mother of 4-year-old baby, and that baby has some infection on nails. I'm not sure about the infection as well. So you can see that among these all, you can see that we have many cards that you are talking to a mother, and this is a difficult card ever, because you will make more mistakes. You will tell, like, especially if you are talking regarding the recommendation, of course you will tell that please try to do. Please try to do means you are advising the mother to do for herself. So the meaning will be different. So whatever can be, maybe the management for infection management after surgery, whatever, there will be many tasks will come to explain him or her regarding the management of baby. There, please try to use the term him or her, like please try to do so and so on for her or for him, so that you will not make any mistake. And another one card, you are working in OPD, and you got one patient who is scheduled for endoscopy. We have already this card. I think this card is already there in my YouTube playlist. You could see endoscopy, because nowadays we are getting one repeated card, and this is a pre-procedure assessment. So regarding endoscopy, you are explaining what are the pre-assessment steps and what are the procedure involves, and post-operative like complications or the after effects regarding like follow-up, everything. Okay, the indication for endoscopy, everything. And at the end, you are getting permission to continue with the vital signs and other pre-procedure assessments. Okay, so this is one card, and another one more card. It is non-case scenario. That means it is in the community health center, and you are talking to a patient who came with earache, and they have given that you have done already the chest exam. That means you have already did the chest examination. So it's past tense. If they have given something like it's past tense, that means it's already got over. So you should not give any introduction. You should not ask their name. Everything have to be in the 3 minutes preparation time. Regarding listening, the A part was conversation with the neurologist, and the second part was with the hematologist. The B part comprises of conversation with the vascular surgeon regarding the vascular problem, the clinical features, the management, everything. And the last part was the conversation with the dermatologist as well as neurologist. And regarding the reading, when we will come to reading, we could see that the A part was regarding kidney diseases, and overall it was kidney diseases, and the A part was regarding the signs and symptoms in adult and pediatrics. The B part regarding the it shows a diagram regarding the management. And then the C part comprises of dialysis information, its importance, different types of dialysis, and the complications, after effects, everything. The last part was post-operative management regarding the surgery, possible like post-operative problems and management, everything. So when you're practicing reading and listening, so it is highly suggesting to get the printout. So please don't go for practicing with laptops or mobile phones. I'm strongly suggesting you to get some printout if it's possible. So you can get the printouts, even if you're doing listening, at least get the printout of your answer sheets, and you can do it. Then in case of reading, you have to get everything and practice it with the paper. If you're doing only 25, even if you did like 20 to 25, but with the paper it will be much effective than you are practicing 100 plus reading practices with your mobile or laptop. So it will give a massive differences in marks if you practice it with paper. I know that in some countries, if you're working in hospital settings, it's very difficult to get some printouts, and it will be costly outside, especially if you are in a European countries. I know that, but if it is possible, try to get some printouts and practice. For every module, it's important. At least for writing, it's okay, fine. You can do it with mobile phones, and even speaking, it's okay, fine. But for listening and reading, there will not be much effectiveness if you are doing with laptop or mobile phones. Okay, so when you do practice for like reading sections, try to do it separately. Like a part separately, you can do like a 10 or 15 questions and write down the marks in a paper sheet. And B and C, whenever you are off or whenever you are getting free time, you can do it separate, but don't forget to write the marks near to the previous A section. After 10 or 15 sections, you can analyze your own marks and getting to know that where you are lacking, where it is A section or B or C. So just give concentration, or just concentrate on those parts, and you can try some more practice sections. If you want to get some basic classes, or if you want to practice the recent type of questions, you can join with my online academy, and I have tutor for reading and listening. And if you want to know the tricks and tips for writing, for the tricks and tips or basics for writing, as well as I can give you a tutor. But if you are nearby your exam and if you want to finish it quick, like recent exam case note for writing, I can help you directly. And if you want the classes for speaking on weekends, I can do it as well. And if you want a regular classes, like as per your schedule, we can manage it with flexible schedule. Whatever, you can try with my WhatsApp number, and you can get some more information regarding my online academy. You can refer to the given WhatsApp number, and you can chat with me if you want to join for the classes. And the classes, if you are a fresher and if you want to join for complete online classes with all 4 modules from the basics, I can allow to a tutor so that you can have your flexible timetable or the schedule, and you can go along with that. And if you are like aiming to your exam, and if your exam is very nearby, and if you are okay with like a letter voice correction and speaking classes on like weekends, I can take for you. But not the regular classes. I could not take a regular class, the classes on a regular basis or the basics because of the time shortage. So I can allow to the trainer. It's okay, fine. And if you want to get the guides for writing, speaking, reading, or listening as well, I will help you. And a writing guide which will be effective, I hope, because I have chosen some recently asked questions. Almost all questions are similar, even until now all questions are same like our old question papers. The pattern is very similar. Even today's letter, like school health nurse, we have many school health nurses letters are there in the guide, as well as the non-case letters, and the same like the letter to the respiratory therapist. So same all letters, the patterns are same. They didn't change anything, any format and all, but there are some changes, few changes it's happened into 2021, which one already we discussed during the previous videos. So if you need any help, you can just WhatsApp in that number, and you can contact me. I will help you to get your B score. Okay, so we will see with another one informative video. Until then, bye, take care.